Here in the historic city of Berlin, at the Congress of the International Headache Society, Dr. Federico Mainardi presented a study on a new form of headache associated with airplane travel. Okay, Dr. Mainardi, so it's a very distinct type of headache where it happens with airplane travel, tends to happen on landing, it's very severe, and then it spontaneously resolves.
Yeah.
Okay. If a doctor has a patient who reports this kind of headache, what should they tell them about preventing it or how to manage it?
Obviously, we have to rule out other pathologies. This is the first step. When we are sure that there is no organic pathology that could sustain the pain, suggest to patient is to take a drug, to take sodium naproxen, among with a decongestant and nasal spray in the
So a combination of a pain relief agent and a spray for the sinus.
Yeah.
And if they know they're the kind of patient that has these headaches, to do that ahead of time, like bring it on the airplane with them, or?
Yes, it depends on the length of the fly, because you know, if you do an international flight, it is not the same thing that a flight that lasts 1 hour, because in this case it is possible to take the drug just before the takeoff.
Right. What do you want to do in the future with this information? You have about 63 patients now.
Yes, our sample now reached 74 patients, and we propose to insert this form of headache in the forthcoming new revisional classification, and maybe it will be appear in the appendix. I'm not sure if just for the data is enough to consent a nosographic entity to consider it a nosographic entity, because further studies are needed, obviously.
Okay, but you're proposing that it be included somehow in the next ICDH3 edition.
Yeah, in appendix I think there will be no problem, but
so at least it will be there if someone wants to look it up.
I'm not sure. This is our proposal, so
right. Okay, you don't know what's going to happen.
I don't know the future.